Hi, and welcome back to Pills and Bills. I'm a practicing clinical pharmacist with a passion for teaching and an even bigger passion for paying off my crippling student debt. I did design this top 200 drugs coloring book by myself to help med, nursing, pharmacy students, and techs learn smarter. So grab a pencil, let's color, review, and make these drugs stick together. If you'd like to color along with me, this book is available on Amazon and TikTok Shop now. And with that, let's begin. All right, today we're talking about Benztropine or Cogentin, an anticholinergic medication that's used to treat certain movement disorders as well as Parkinson's disease, and it is classified primarily as an anti-Parkinson's agent. We have our two primary indications, which may initially seem unrelated, but they share a similar imbalance: too much acetylcholine activity relative to dopamine activity. You may be familiar with Parkinson's disease, but what are drug-induced extrapyramidal symptoms? They're involuntary movement problems like stiffness, tremor, or restlessness that occur when dopamine signaling is blocked in the brain's motor pathways. Benztropine can be added to an antipsychotic regimen to reduce these symptoms. And next, we have our PharmaLink phrase. This is a quick memory hook that your brain can latch onto to better remember the brand generic pair. Let's refresh on Parkinson's disease. Its motor symptoms like tremor or stiffness happen because dopamine levels drop in the basal ganglia, which is the part of the brain that coordinates smooth, controlled movement. When dopamine is low, acetylcholine becomes relatively too strong, and benztropine helps restore that balance. Parkinson's occurs because these dopamine-producing cells slowly die off after accumulating abnormal proteins over time. Research has indicated this may be due to both genetic and environmental causes. To remember, benztropine is used for Parkinson's disease. You can think parkin the Benz, like parking a luxury car. This one might seem a little silly, but it has genuinely stuck in my head since pharmacy school when I could not keep neuroagents straight. Hope it's stuck in yours now too. When you think side effects for benztropine, I want you to think anticholinergic. You can flip to our cholinergic system review to remember the typical anticholinergic symptoms. Once you have typical anticholinergic symptoms down, you can remember that any medication that decreases acetylcholine has the potential to cause these. Much easier than remembering individual side effects. Overall, this medication is going to affect normal control of body temperature, gut motility, heart rate, and ocular focus. Moving to warnings, the first is for glaucoma. You can use this agent cautiously in patients who have controlled glaucoma, but it's contraindicated in those who have uncontrolled narrow-angle glaucoma. In these uncontrolled patients, benztropine can dangerously raise pressure in the eye by blocking fluid drainage. This can quickly become an emergency and potentially cause blindness. Our second warning is for worsening of existing psychiatric symptoms like confusion, hallucinations, or agitation, with the highest risk being in older adults. We've already explored our mechanism, but in summary, benztropine works by blocking muscarinic acetylcholine receptors in the CNS. This helps rebalance dopamine and acetylcholine's relationship in movement pathways, which reduces symptoms like tremors, rigidity, and EPS. And that completes our review. See you next time.